We are in the MCPS class and epidemiology is the main topic we are discussing, and we have already covered definition of the epidemiology in case series, case control as well as ecological study, which is a city-based or country-based study which we cannot implement or apply on an individual basis. But these are the studies which can be applied at the individual level also. And today we shall discuss the cross-sectional study with this example. Suppose hypertension in a male population is supposed to be studied in any locality, suppose in Hyderabad, any town or any area. For my purposes, the Rani Bagh area or even the Fuleli area. So you can select the area and a population of 1,000 above the age of 30 years, because nowadays the younger population is also suffering from the hypertension and other diseases. Detailed history about life cycle is issued, and we will collect some of the information. Means blood pressures were recorded as per the WHO guidelines. Hypertensive were identified as the guidelines of the WHO, and the data is presented as follows. I think I am clear that you will select a sample, and here we are selecting a 1,001 population, and there are many formula. According to that you can select the sample size. So here, just for our example purpose, we have taken 1,000 out of 10,000, 12,000 population of that area. Yes, next. So after the study and questionnaire and a survey, you will, इसको थोड़ा stop करो, ये आज़ाद मत होना। Just saying that cross-sectional study is also called prevalence study, and we have selected an area from Hyderabad city and 1,000 population. Some of the basic information, age, sex and lifestyle was collected, and blood pressure was measured as per WHO guidelines. It means the cutoff point was 80 and 120 millimeter of the mercury. We will have this kind of the table. You can see that this is the total population, and not exposed or this is related about the smoking and not about the hypertension. So you can see that out of these obese and hypertensive, supposed to be hypertensive, we had smokers almost 400 and non-smokers 600. So we will calculate the prevalence in the smokers, but on this column you can see that the hypertension was not present in majority of the non-smokers, and it was almost out of 400, 200, 120 were having this hypertension, and here where the smoking was not there, 30 were showing the hypertension. So this shows that there is a link between hypertension, obesity and smoking, and how we will calculate we shall see in the next slide. So the same thing is there, and you will have this, we call it 2 by 2 table, and 1,000, 120 had smokers had a hypertension, 30 not smoker had a hypertension, so total 150 had a hypertension. So out of 150, the smokers were outnumbering in the data, and the same is that this will be the prevalence A column 120, A plus B 120 plus B is 280. So if you calculate here, 120 is there, 120 plus 280, 400, so 0.3 or 3% prevalence is calculated among those smokers. But if you see the same formula, then it is 0.5, so it is much less. Here is the 3%, here is almost 0.5% or 0.5%. So this kind of study gives us a clue that what is the burden of the disease or the load of the disease or how many people are affected from certain factors. So in that way you can see that the population is there, smoking is there, hypertension is there. Is there any association, link or connection between these factors or not? And by calculating you can compare where is 0.3 means 3% and here is 0.5 means 0.5%. So you can conclude at the end of the study that smoking, if it is reduced or it is not practiced or done by the community, the hypertension will also be. But we can't say conclusively that this is related with that factor. For that we need to study and we will discuss later on. Next please. Yes. So these are the few advantages and disadvantages. You can see that investigation of a disease, the cross-sectional will not help us, but ecological studies, case control studies will help us. And if you see testing multiple effects of cause, cross-sectional is much better and easier. And the last is, if you can see that if you are measurement of the relationship, then you have to consider the other studies, but cross-sectional is not there. So at least two advantages. One is testing multiple effects of the multiple effect on the cause or the factor, and second is study of multiple exposures and determinants. This study is very useful. These are the advantages. Next please. And coming to the other aspects also, if you see the cross-sectional, the recall bias is very high, because at one time when you ask a question, either the memory can be impaired or that person can give you a casual reply, yes, no, nice. So that is one of the disadvantages of this. And if you see the selection bias, then it is medium, but I think we can have that which bias is high in the cross-sectional study, and that bias can be recall bias, selection bias, and other biases are also interviewer bias and some of the other. So we can have a high bias in the cross-sectional study. So that can be the disadvantage. And the cost, it is a medium cost. So it is not a low cost. And when we say low cost, then we have to be an ecological study. And if we can see the cost, the cohort study will have the highest cost. So we can ask the MCQ that which study is of the low cost, which study is of the medium cost, which study is of the high cost. Next please. So some of the guidelines are that the criteria must be set about the disease or condition under study. Second, population adequately defined. Suppose it is Hyderabad, it is Kasimabad, it should not be vague. The map and other parameters should be there. Sampling method should be proper, and the measurement or the data collection or the instrument used or the anything, suppose here we are using in our study the hypertension. What type of the apparatus we will use, that should be clearly defined. Next. Secondary guidelines are also there. How large was the point estimate, means how much time or how much the study was the large, how precise was the point estimate, and we can use the 95% confidence. And another is, are the result applicable to the population? Second, what is the magnitude of the problem? So these can also be the guidelines before the study. Next, please. Yes, these are the few references, but I will go in the start some of the charts about the. So please show some of the charts in the initial of this topic, then we will conclude, and we will have this. Yes, this is the design of the cross-sectional study. You will start from the reference or target population, sampling, sample, and then you can have these characteristics, exposure or outcome, and then the characters. So multiple factors or effects are the things you are studying in the, suppose we have studied smoking, hypertension, obesity, so you can have on these things, and the measurement is important. You have to measure or quantify this. Next, please. Yes. This is another key, that time is important. This is a single time, so you can't see whether the disease started first or exposure started the first. While in other studies you can clearly see the past exposure, and in cohort you can see the exposure over the time or at the start of the study. So this is an egg and chicken situation, where we ask you, egg was first or the chicken was first. Some people will say chicken was first, egg was second, some people will say. So this is the egg chicken type of the study, in which exposure and outcome both are studied at the same time. Next, please. So steps are, the criteria is already there, co-variables being there, ethical issues are important. Every epidemiological study must be ethically approved. Community should be informed. Consent should be taken from the people and from the institutions or from the government or from the local community. And inclusion criteria and exclusion criteria should also be mentioned, that these people, suppose we have 30 and above people, we will not interview the 25-year age or 20 years age, because we have set the criteria. Next, please. And these are the some of the data. Clinical examination can also be part of this study, and minimum number of the sample is required in this study. Next. So these are some of the steps: record, then interview, then summarizing the data, analyzing the interpreting finding, and then a final report is shared with the community or with the authority. Yes. This is analysis of the data, and here we can go up to the nominal data, means prevalence rate and proportion, and if continuous data means in points, suppose 5.5, 5.2, But here in nominal data it is almost 1, 2, 3, 4, or a whole number is there. So we will have prevalence and proportion, and here we will see the mean, standard deviation, median, and sometimes percentile. Next please. So with this I think we are concluding for continuous variable measurement is correlation and regression coefficient. This will be a part of the higher study, but nominal data, odds ratio, rate ratio, prevalence ratio, and exposure ratio. But here we are interested in the prevalence ratio. Odds ratio is calculated in the case control study, and relative risk is or exposure is calculated in the cohort study. So with this I think this type of the table you must understand, and you can fill it and we can calculate it. So at the end I think if you have understood the cross-sectional study, its design, what is prevalence, what are its limitations, what are its good points, what is the cost, and what are its disadvantages, and how you can calculate the prevalence, and how you can put the data into the table and ultimately calculate that exposure or the disease and non-disease other population. And in that way cross-sectional study is easy, simple, as well as quick, low cost, but it has certain limitations. I think the FCPS students will be given a scenario. Suppose in Hyderabad you are interested in a study of cross-sectional type, how you will proceed with this. So you will select the population, reference population, then sample, then collect the data of the multiple factors, measurement, and ultimately you will calculate the prevalence. So if you have understood something better for your post-graduation, undergraduation, whether you are in the MBBS, MPH, MCPS, FCPS, I think this brief video will give you some kind of the in-depth understanding of epidemiological study, and this is one of the commonly done and published studies in your journals. Cross-sectional word is very common. So please like it, share it, and write comments if you have any observation or any interest in that. Thank you very much.